Okay, everybody. For some reason, YouTube decided to eat my general patient care video, so we're going to start that again. I apologize for that, but you guys know sometimes technology is our friend and sometimes it's not our friend. So we're going to talk about the first thing, kind of all of the things that we do when it comes to patient care. We have talked about general patient care before, but I want to go over it again because it's really important to understand how all of the steps of your all of the steps of taking care of a patient encounter. Um, they interact with each other, whether it's collecting patient history or it is the way you introduce yourself, the information that you get, how that correlates onto the doctor, and all that. So just remember that, especially that the impression that a patient gets from you, how you introduce yourself, how your body language is, how your tone is, how you're dressed, if you're dressed professionally or unprofessionally, if you look like you just got your clothes out of a dryer and they've been sitting all day and they're all wrinkled. Patients, they look at that and they determine how competent they feel like you are based on the way you look. So you want to make sure that when you show up to work, that you are clean, you're neat, and you have a professional appearance. You also want to make sure that you do everything you can to make the patient feel comfortable. Make them feel open to be able to talk to you when you ask them questions. That will help the physician when he comes in. Also, it makes them more open with you and more willing to talk to you about what's going on so you can get the most information. So walking up and calling a patient to come back, saying Miss Jones, um, and when Miss Jones comes up and is ready to go back to get her vital signs done, taken, and weighed, you greet her and you say hello, how are you today? Give them your name. My name is Jana, and I'm going to be working with the doctor today to help take care of you. Explain to them what you're going to do. It's important for patients to know what you're going to do and about how long it's going to take. It's going to take us about 3 or 4 minutes, and we're going to get your vital signs and get you weighed. I'm going to come back and I'm going to take some health history or verify your health history, your medicines, all those kind of things. In the room and ask you a lot of questions, and that's going to take us another 5 minutes, and then I'll let the doctor know you're ready, and he'll come in as soon as he is available. Don't say as soon as you can to someone, because as soon as you can, or as soon as that doesn't tell them anything. But you're going to be there are 2 patients ahead of you, or you're the next patient. Let them know that kind of information. That helps them. So a medical assistant, you create a positive atmosphere so that you have a positive outcome for the patient. Sometimes we have to have patients that are having difficult times or have difficult issues, and we need them to feel, once again, need them to feel comfortable. The purpose of the general exam is so that we can confirm the patient's overall health and get their chief complaint, especially when it is a general physical exam that they are having once a year just for follow-up on their routine medicines. That kind of gives us a baseline. It gives us their average blood pressure, height, weight, and we can compare that. Some patients need to come in once every 3 months, some every 6 months, and some once a year. But we can compare those vital signs from one visit to the next for those specific things. Also, we have to be able to examine a patient to determine medical diagnosis. So doctors examine it. We help them with a physical exam, and that's how they determine their medical diagnosis. And remember, diagnosis and proper diagnosis is not only important for treatment, but it's also important for billing. Know that as a medical assistant, your job is to not only assist the doctor, but the patient. You're going to be helping them in and out of the room. You may be helping them in and out of a gown. You may be helping them with teaching them related to wound care. You may be teaching them on diet. There's lots of things that you will be assisting the patient and the doctor both with. So your presence enables the doctor to perform a really effective exam as quickly as possible. You do the interview, you collect accurate history information, you collect specific height, weight, and other vital signs, and the accuracy of how you do that determines how well the patient's treated. You also need to know that you will have to set up the room for the physician as well as clean up after. So if a patient is coming in for a skin lesion, then you need to have all of the instruments that the doctor normally would utilize set up before you go get the doctor. Also know that once you're done, you'll be assisting him with the procedure. He'll go on to the next patient, and you'll need to dispose of and clean up and take care of and process any specimens. That'll be your job. It just is part of what you do. Now, safety precautions, we have to be sure, don't ever forget when you walk in and when you leave a patient's room, wash your hands. Also, if you go to the bathroom, if you leave the office, if you eat, wash your hands before and after. It cannot hurt you. We want to make sure we're wearing appropriate PPE, personal protective equipment. So if you're going to be touching body fluids, if a patient has an open wound, if you're going to have to collect urine, you're going to have to collect blood, if you're going to come into contact with skin that is sweaty or potentially infected, or has raised red areas on it, you want to wear gloves. If you're going to have a patient who has cough, congestion, or you're worried they possibly could have TB or tuberculosis or some other kind of airborne disease, you want both you and the patient to wear a mask. If the patient's just in for the flu, then we probably are going to ask them to wear a mask. But we may wear one as well once that flu diagnosis has been confirmed. Other times to wear PPE, if we're going to do wound care or you're going to be dealing with a patient's body fluids, you're going to wear the amount of PPE that's necessary. So I don't need to put on a full gown if I'm just going to go in and give someone a shot, but I do need to wear gloves. Now, if a patient has TB, I need to cover my hair, I need to cover my clothes, I need to wear gloves and a mask and a face shield or an eye shield. Because I have to see other patients, so I want to not be contaminated if they're coughing in the room. Same thing with wound care. I probably don't need to I have short hair, I don't need to wear a surgical cap, but I do need to wear a gown, gloves, and maybe even shoe covers depending on the location of the wound and how dirty or how much cleaning I'm going to have to do. Also, when you clean the patient's room after a patient leaves, depending on the type of visit will determine what all you wipe down. You need to wipe down surfaces that the patient's body, their body has come in contact with. Not necessarily their clothes, but their skin. So if a patient is on a table and they're not touching the table, they're just sitting on an exam table on the paper, then we're just going to change the paper. But if the patient takes their shoes off because they're a diabetic, we want to be sure that we clean a surface where their feet have touched, clean surfaces where their hands have touched. So if they've laid down on a table, we want to be sure we wipe it down. We want to be sure that if someone has, if we've done wound care and they've bled, or we've drawn blood and they've bled, we want to be sure that's cleaned up appropriately. And to clean blood or to disinfect, remember this rule, and you will hear it and you will see it again. Remember that a bleach solution is what we use to clean quickly in an environment, and it is 1 part bleach and 10 parts water. So it would be 1 to 10 ratio bleach to water. So if we put a half a cup of bleach, we would need 5 cups of water. That's how you would mix that. If we have 10 milliliters of bleach, we need to add that to 1,000 milliliters of water. And I'm going to ask you the question kind of in that manner. If I'm going to add 10 milliliters of bleach, how much water would I need to add to that for a disinfectant solution? So be sure that you're aware of that. Other things we have to prepare a patient for the exam. Think about different things that go on with a patient. Sometimes we're doing pelvic exams, sometimes we're doing breast exams, sometimes we're doing prostate exams that can be embarrassing for the patient or difficult for the patient. So we want to be sure that they have an opportunity to change their clothes and be draped for the least exposure possible. We want to be sure that we prepare the patient by explaining to them what's going to happen in a very soothing tone. We need to be sure that a patient has a gown and they understand how to put it on. They understand that when they change clothes, that if they're going to have a breast exam, it has to be open in the front. If they're going to have a prostate exam, it's going to be open in the back. Also, they need to be given a sheet that we can cover them with, so that the only parts of the body that are exposed are what is necessary. You want to protect your patient's privacy. You want to make sure the door stays closed. You want to be sure that you knock on the door before you go in. If you're telling a patient, I need you to put this gown on, and I need you to take off everything but your socks, and they know that they are going to be naked except for socks underneath underneath the gown. Be sure that you give them a sheet to cover their legs. Be sure that that they're aware, and be sure that you knock so that when you go in the door, you know that patient is ready. We don't want to leave a door cracked open. When someone's changing, we want to make sure that their privacy is protected. Also, we want to be sure they understand what position that they are going to be in, because we have patients with severe back pain, breathing issues, weight issues that may not be able to lay in certain positions. So we need to tell them what position they need to be in so that we can make modifications or adjustments if the patient can't do that. We can't lay a COPD patient flat on their back. They can't breathe. We also can't lay a 8-month pregnant woman on her belly. So we have to be aware of all of those things. Let's talk about positions. You will definitely need to know positions. So supine would be laying on the back, prone would be laying on the belly, dorsal recumbent would be sitting with your back against something in a reclined position, and they're showing dorsal recumbent. Lithotomy would be in the position where we would perform a pelvic or a rectal exam, where someone's laying on their back with their heels in stirrups and their legs bent, where their genital area is exposed. We will cover them until the time that the procedure needs to be done. Trendelenburg is generally for patients who have a low blood pressure, and that is when the head is below the feet. Fowler's position would be sitting at a 90-degree angle. In turn, semi-Fowler's would be at a 45-degree angle. And Sims position or kneaded chest would be a person laying on their left or right side with one knee bent towards the chest. So be sure you're aware of what all of those positions are. We also have to think about patients' culture and religious preferences, and also about their background. We have to think about educational background. We do not, also when we're explaining, we don't want to lump a certain type of people in one category. We don't want to be judgmental of our patients. We want to respect each person's beliefs and cultures to the best of our ability, and we want to provide them with the best appropriate care. So if a patient doesn't look you in the eye, understand that in that specific culture, it may not be respectful to look someone in the eye. Understand that there are certain faiths that don't believe in receiving blood products. There are certain faiths that don't eat specific types of food. They may need kosher meat, and they may not eat any meat that comes from the backside of an animal. So, some cultures don't eat certain types of meat. They don't eat beef, or they don't eat pork, or they don't eat chicken. So be aware. Be aware of those kinds of things, so that we are not telling a Jewish patient that it's okay to eat ham. They don't eat ham. So just kind of be aware of those things, okay? We also have to be aware of patients with disabilities. It's also the law. We have to have handicap accessible areas for patients. That includes bathrooms. We have to be able to provide assistance to patients in wheelchairs that are on walkers, that have canes. We want to make sure that they are as mobile as possible, as safe as possible. We want to make sure areas are clear, that there's no cords, no lips. We want to make sure that we notify patients if they are going to need, if there's going to be a bump or a slope coming, so that they don't fall. Also, we want to be sure that we are aware we may have to help them change their clothes. We may have to help with transferring from chair to exam table and then back. So be sure that that you are mindful of that and respectful of that, and ask. Don't leave a patient in a wheelchair on an exam table and they can't get to their wheelchair or their crutches or their cane. Be sure that they have all of the equipment necessary that they would need in case of an emergency. Also, with kiddos, we have to be real careful with our kiddos. Kiddos sometimes can be the most difficult because they have to be comfortable and they're already scared because they're at the doctor's office for the most part. So we want to let families comfort them as much as we can. A newborn, we're going to have to take care of them on the exam table. But or an infant, we want mom or dad or whoever has brought them in, their guardian, we want them to be there talking to them, soothing them, making them comfortable. For a toddler, we want them, as much as they can, we want to allow them to sit in their parent's lap to be examined. We want parents to help us with activity related to anything related to listening to their lungs, listening to their belly, anything that might impact them in a major way. So we want parents to be available. When they're preschoolers, we can pretty much put them on the exam table and give them one-step directions. Just give them one thing at a time. Your doctor is going to listen to their lungs. He's going to assess areas that may be painful last. So he's going to do the least invasive, which means listening to, looking at first, and then palpating and doing things that may be uncomfortable last. Other things is that older children, sometimes that as children get older, we have to do things that may be embarrassing for them. We have to look at areas they're not comfortable with. So we want to make sure that that's done last. The doctors generally do that last. You may have to witness with the doctor. Be sure you do your best to make them feel comfortable. We have to be real mindful of pregnant women as well, because they can't always lay on their stomach, and they can't always put their legs in stirrups. They can't always be in the lithotomy position. So we want to make sure that they're either in the recumbent, the dorsal recline position, or in a position that they are comfortable. Lots of times they can't lay flat either at the very end of the pregnancy because it will make them short of breath. So be sure that you discuss with your pregnant person what they are comfortable with and what they possibly can do. So let's look at this. An elderly female patient needs her lower abdomen and genitals examined by the physician. What would be the best position to put this patient in? Would we put them in the lithotomy position, or would we put them in a dorsal recline position? Now, this is an elderly patient. So we would put them in the dorsal recline position because lithotomy in the stirrups, lots of times with those legs being bent that direction, is very difficult for them. Their pelvis and hip joints sometimes don't move that way. Exams that they're going to be doing. I want you guys to remember those bold words, and it's going to be done basically in that order. So be sure that you're taking good notes and you know what each one of those means. So and this is that least to most invasive procedure. So we're going to inspect. That means just looking and seeing what's going on. Then we're going to palpate, which is light touching and assessing characteristics of the body. Percussion is basically tapping or striking body parts to hear sounds and feel vibrations. Auscultation is listening for sounds. We may inspect and then auscultate. We may measure before we palpate, so we may have to measure wounds. We may measure wounds later on if it's going to be painful and we have to uncover a wound before it's going to be, before it's going to have wound care provided. And then manipulation, we do that last, getting patients to move or moving body parts that are hurting. We want to do that last. So the reason why we do an overall physical exam is to make sure that we are looking at that patient and asking questions about them from head to toe. Now there's going to be specific questions that are going to be set up for you most of the time in a template that is related to digital software that is specifically for you, and then the doctors will have their specific information. For the most part, medical assistants are asking yes or no questions, and if it is a yes, then it may have some supplemental questions, like asking about the patient's skin, hair, and nails. Do you have brittle nails? Are you having any open places on your skin? If they have open places on your skin, it's probably going to pop up another question that says location, and then it asks you to give some brief description, like it's red or it has drainage. Same thing when it asks you about the head, neck, ears, eyes, and nose. It's going to ask you for irregular. Is everything normal, or are there irregularities? Are their teeth missing? Are they complaining of a sore throat? If so, for how long? Are they having any sinus issues? If so, how long? Are they having any drainage from their nose, eyes, or ears? If so, what color is it? How long? Are they complaining of any neck pain? If so, what kind? How long? How much? Same thing with the head. Are they having any headaches? If so, what kind? How long? Those are the things that will pop up for you. And you're going to have, for every section of the body, you're going to have information. You're going to have those assessment questions. It's going to ask you about respiratory. Are they having any shortness of breath, any cough, any congestion? If so, how long and how severe? Are they having, when it'll have a circulatory system that pops up, and it'll ask them if they're having any chest pain, are they having any feeling like their heart is racing, are they skipping beats? If so, when did it start? And is it all the time or frequently or infrequent? Are they having swelling in their hands or legs, feet, arms? Are they having any swelling anywhere? So they're going to ask questions like that. It's going to ask about the abdomen. Are you having any nausea, vomiting, diarrhea? If so, when did it start? How long is it lasting? How many times are you having vomiting or diarrhea a day? It's going to ask questions specifically like that. That's what you're going to be asking the patients. The doctor is going to come in and truly do all of the real assessment on patients. He's going to be listening. He's going to be ordering different kinds of testing and swabs and those kind of things. So like I said, just be sure that you are following what you are supposed to be doing as the medical assistant. Also, in preparing the room, be sure that you know what kind of visit the patient is there for. And when you know, then be sure you're setting it up so that when the doctor comes in, the visit runs as smoothly as possible. So that if the doctor needs an otoscope and an ophthalmoscope for a visit related to ears or eyes, that they're available. If they're going to do a pelvic exam, you want to make sure speculums, cervical scrapers, and wet mount lab specimens are available for him and ready to go. And know that you're going to have to potentially, if it is a male, you're going to have to be in for that visit. Just know that you have to be comfortable with being sure that the room is ready. If you don't know, ask the physician. Never doubt being able to ask the physician. Then once again, he's going to go through and ask. You're going to ask health history questions too. You're going to ask if they have a family history of diabetes, hypertension, if they have family history of migraines, of cancers. You're going to be asking them when they had their last period, when they had their last bowel movement, if they have any burning when they urinate. if they have any blood in their urine, if they have any blood in their stool. You're going to ask those yes, no type of questions. You're going to ask them if they have family history of glaucoma. You're going to ask them, just kind of what their family history is. You're going to ask them, and these are tough questions sometimes for new staff members, but you're going to ask them if their parents are still alive. And you're going to ask them if they died, how old were they when they died, and what did they die from. I know that sounds kind of crazy, but you do have to ask those things because they help the doctor determine medical outcomes. Also, we ask about all of their medications. We have to make a list of all of their medications. So this is that assessment that the doctor does. I'm going to let you guys go through and read what he does. And this gives you some specific information related to rectal exams. If someone's going to have stool collected for a guaic, and the doctor's going to do it from a digital examination. Digital means finger examination of the rectum for lesions or irregularities, and then collect a little stool while he does it. They also do prostate exams, sometimes rectally. If the patient complains of numbness or tingling, you're going to need a reflex hammer because most likely the doctor is going to test reflexes. You're going to ask about their emotional state. You may have to ask, are they feeling suicidal, or if they are sadness, they have a lot of days where they're sad. When we complete the exam, when the doctor has finished, he's done everything he's needed to do, he's given you all the orders he wants. Maybe he's had you order labs and you go in and draw labs. Maybe it's a wound culture. Maybe you're having to give a flu shot. Maybe you're having to give them something for pain like Toradol. Maybe you're giving them a depot shot. Maybe you're giving them hormone injections. Once that's all done, you want to verify with the doctor that he is finished with the patient. You want to go back in and make sure the patient doesn't have any questions, and and then escort that patient to the front or to the door. Those are really important things, but make sure that the doctor, even though the patient says that they're ready, the doctor's ready for them to go, make sure the doctor's ready. You don't want to have to call that patient once they gotten halfway, go home and say, we didn't get your labs in on time. I'm going to need you to come back. So just clarify with the doctor that everything is complete. Okay, guys, you have a great day. I'm sorry we had some technical issues, so we will put everything off one day. So that means your test will be a little bit later. So you guys have a great day. Thank you so much.